Good day, class. In this video, we are going to study another disease, common cold. Common cold is one of the most common diseases that's in our daily life. It refers to a viral infectious disease that infects the upper respiratory system. So the location for common cold is in the upper respiratory system, which means that this disease has not developed into the lower respiratory system. So from here, you need to distinguish from pneumonia. Symptoms. The common symptoms include runny nose, nasal obstruction, cough, headaches, aversion to cold, and fever. Common cold in Chinese medicine mostly related to the wind, but we still need to consider the onset of diseases. Apart from the pathogens, we also need to consider from the body constitution. So in this situation, the patient also may experience with the weak antipathogenic qi. That's why the pathogen may attack the human body because of the weakness of the antipathogenic qi. So from the treatments, you also need to consider from these two aspects. One from the pathogens, the other is from the antipathogenic qi. As you can see from the common symptoms of the common cold, wind cold, wind heat, and wind damp. And most of them, actually all of the symptoms we mentioned here includes wind. The reason for the wind is most of the common colds, the patient will have a history of wind attack, such as in cold environments with the wind. In a raining day, overexertion that may result in weakness of body constitution. This overexertion can be the physical work, mental activities, or the sexual life. Drinking in a windy environment. The rain refers to someone walk under the rain. So this may related to the coldness, the wind, and the dampness. But for the onset of common cold, it must accompanied by the weak body constitution, or the weak antipathogenic qi, or the weak Wei defensive qi. You see, we use different terms. Actually, we describe the same aspects of antipathogenic qi, or Wei defensive. As the qi go to the superficial level of the body to protect from the pathogens. When we see a patient present with common cold, with runny nose, headaches, we need to differentiate from common cold with common cold and influenza, flu. Common cold, most patients will present with mild symptoms. Common colds, most of them they won't develop into other diseases. But for flu, sometimes it can, from the onset, it may be more severe. It also may develop into other diseases. So from traditional Chinese medicine point of view, the development, it may develop from upper jaw into middle jaw or lower jaw. It may develop from qi Wei level to qi level, yin level, or blood level, or from the sixth meridian differentiation from Taiyang disease to Yangming disease to Tai-Yin disease or Zhao-Yin disease. So for flu, it's more likely to develop into more severe conditions. Pandemics. Some pandemics, not all, such as COVID-19, we are in a pandemic now. COVID-19, especially at the beginning, many patients present with symptoms similar to flu. or similar to common cold, nasal obstruction, fever, cough, even diarrhea. Some of them may present with loss of smell or taste. But for pandemic, we need to inquire the history, the living history. So most patients will have a very obvious contact with the confirmed cases or the affected area or the risk areas, the location. For example, in one city, there are many cases there, or in one area, district of the city, there are many cases there. But this patient has traveled to that specific area, and in this situation, this patient is more likely to suffer from some pandemics. So the medical history, the traveling history is very important for pandemics. In this situation, if you suspect that this patient may suffer from pandemics, not has to be COVID-19, you need to send the patient for the further examinations and follow the protocol for the specific disease. For common cold, the most common symptoms include nasal obstruction, a runny nose, sneezing, itchy throat, sore throat, body ache, headaches, aversion to cold, fever, or aversion to wind, etc. If this common cold is accompanied by heat, dampness, summer heat, or dryness, the patient may present with other symptoms. For example, if the common cold, especially the wind, accompanied with summer heat, the patient may present as fever and heaviness, fatigue. Present with accompanied by dryness, the patient will present as dry mouth, dry throat, dry cough. Common cold can happen in all seasons, but they are more popular in winter and spring. The wind cold attack, the wind heat attack, and wind damp. The wind cold attack, the patient will present as something relating to coldness. The wind, the patient may have a history of experiencing the wind. The location of this disease, the location of the common cold is the lung. So the treatment also we need to focus on the lung. Coldness, clear phlegm, that's coldness. Aversion to cold, mild fever, no sweating. No sweating is due to the characteristics of coldness. Coldness can constrict, so it can constrict the pores, or it can constrict the superficial level, the superficial skin. It will stop sweating, so no sweat. The patient, when you palpate the skin, the skin will be very dry. The patient also may present as headache, heavy sensation of lumps, no thirsty, because the coldness is an impathogen. It won't consume the fluid. Or thirst with a desire for hot drinks. In other situations, if the patient would like to drink, they will prefer hot drinks, thin white coating, floating or floating tense pulse. Floating pulse, you see all these are floating pulse, no matter what kind of syndrome. Apart from dampness can go deeper. Dampness will have the chance to move downwards. That's why the pulse may not be floating. But for wind cold and wind heat, floating, because floating can indicate the superficial level, which means the disease is still in the superficial level. in the weight level from the 4 levels differentiation methods. When heat, nasal obstruction will less discharge. When cold, will have clear discharge, and also can be perfumes discharge because the coldness, the heat will concentrate the discharge. That's why you will see less discharge. Sticky phlegm, yellow phlegm. Yellow is the color of heat. Sticky phlegm, also because of the heat can concentrate the phlegm. That's why the patient will present as sticky phlegm. Red facial complexion, sweating. The heat can open the pores. The heat also can force the body fluids to come out. That's from the heat. That's very similar. The sting. When you sting your food, the heat, air, the sting is coming out from your pots. The heat in the body, the sweat will come out from the body. Patient may present a headache, distending sensation in the head due to heat. That's also the characteristics of heat. Red facial complexion, thirst with a desire for cold drink. Yellow urine, dry stool, thin yellow coating. The coating must be thin, especially from the first few days. Once the coating becomes thick, it means this disease already affects the internal organs. It's not in the weight level, you go to the qi level. So in the treatment, you need to focus on the spleen if it becomes thick. You need to focus on the lung and spleen. But if it's still thin yellow coating, the thin coating, it can indicate that the disease is still mild and also in superficial level. So you still can focus on the lung. The lung, from the function of the lung or the characteristics of the lung also related to the skin. That's where the superficial level, what we call the weight defensive. You see, all these are connected. The skin, from the superficial level, from the depth of the human body structure, skin, the muscles, bones, skin, also the superficial. The common cold is going to affect the lung, the skin, the cold attack on the skin. When you are experiencing coldness, the skin, you feel coldness from the skin. So that's in the theory, we think that this is the cold attack the skin. So all these theories, they are all related. Thin yellow coating, floating. When you see dampness, the patient must present as heaviness. Heavy and distending sensation in the head. Chest tightness, poor appetite, distending feeling in the abdomen, loose stool or diarrhea due to dampness. The heaviness and distending sensation in the head, in 黄帝内经, it described as what kinds of sensation the patient may feel. In 黄帝内经, it says that this is a feeling that it feels like that the patient used a towel to hide or to cover their head. So you just try to feel what kinds of sensation when you cover your head with a towel. So the kinds of heaviness and pressure. Chest tightness also can be the dampness. The chest tightness and chest oppression, these two are exactly the same. Sticky white phlegm, white, because dampness is a kind of pathogen, still sticky. The treatment principles: when cold, no matter which symptom, we're going to dispel the wind, but we're going to focus on specific pathogen, coldness, heat, or dampness. So we're going to, for when cold, we're going to focus on the coldness. For coldness, we can use Moxibustion. Because this is the pathogen attack, so we must reduce. But in the meantime, you also can reinforce from the Moxibustion, or if this patient presents as weak body constitution, you can use the combination of reinforcing and reducing. When heat, dispel wind and heat, we can use acupuncture only. We don't use Moxibustion because of the heat. Dampness, use acupuncture, reducing technique. Points you can choose GB20 to 14, lung 7, large intestine 4, 三焦 5. GB20 风池. This point we have mentioned quite a few times. 风 means the wind. Wind. So 风池, 池 is the pool. The pool. The pool of the wind. This point is very commonly used for anything related to wind, no matter internal wind or external wind, or exogenous or endogenous wind. The 风池 GB20 is very commonly used in diseases that are related to wind. The common cause, the wind also from exogenous pathogens. 214 is the connecting point of yang meridians. It can relieve the heat. It also can activate the lung. Large intestine lung 7 裂缺 is on the lung meridian. Large intestine 4 can activate the circulation. Especially when we use the GB20 to 14 and 三焦 5. These 3 points, when we use together, it can dispel the wind and for other pathogens such as the heat. 214 can relieve the heat. Large intestine 4 and lung 7, these two can, when used together, especially for lung 7, it can help the lung to stop coughing. The large intestine 4 and lung 7, when we use as a pair in one prescription, this is also according to the selection, the principle of the special points, according to the yuan source points and luo connecting points, the combination of yuan source points and luo connecting points. For wind codes, you can add bladder 12, bladder 13. Bladder 12, 风门. Meng is the gate. So it's the gate of the wind, So that's why bladder 12 also very commonly used for wind. Bladder 13, 肺腧, the back shu points for the lung. 214, bladder 13, 214, bladder 13. These 3 points also very commonly used for allergies, for asthma. So these are very commonly used. When heat, large intestine 11, lung 5. Lung 5 can relieve the heat. and clear the heat. Wind dampness, zone 12, stammer 36. See, when we talk about dampness, we focus on the spleen because the spleen is in charge of the transportation and transformation of the water metabolism or the fluid. The weak body constitution, we're going to strengthen the back zoo from the bladder 13 and stomach 36. Nasal obstruction, you can use the local points, large intestine 20. Large intestine 20, the needling technique is the bird packing technique. Sometimes the patient may experience the relief immediately, just after a few minutes. Large intestine 12 is also very commonly used in rhinitis, especially if the patient presents as nasal obstruction. Headaches depends on the location. You can add, if on the side, you can add HN5. In the forehead, you can add HN3. Sore throat, lung 11. Lung 11, you can use the prick to cause bleeding. In cold, we use Moxibustion and Acupuncture, do 14, 12, 13, and stammer 36. We can use the warm needling technique. When heat, do 14, lung 11. You see, because of the different pathogens or different symptoms, when cold and when heat, for the same points, we will use different technique. Do 14. We're going to, for when cold, we can use Moxibustion. For when heat, we will prick to cause bleeding. The treatment may be applied once or twice a day. Other treatment techniques include the 3-edge needling technique, cupping, mainly focus on the back zoo points, on the bladder meridians on the back. Auricular acupuncture you also can use. In this video, we mainly introduce common cold. The symptoms of common cold, such as runny nose, nasal obstruction, headaches, these symptoms are very common in many different diseases. So when we see patients present with these symptoms, it is very important to exclude some other diseases, especially different pandemics. Pandemic doesn't have to be COVID-19. There are many other pandemics that also may present as these, especially at the beginning, may present as these similar symptoms. So it's very important for us to differentiate. Acupuncture can be used for common cold. However, if after a few days the patient still suffer from very severe symptoms or even fever, high fever, severe coughing with blood, then we have to use comprehensive management, including it depends on including either conventional medicine or Chinese herbal medicine. Although we study all these different diseases that's from acupuncture, I have to say that for some internal diseases, Chinese herbal medicine will work much better than acupuncture. So in some situations, we need to consider the comprehensive treatment plan. In a milder situation or in an early stage of common cold, we can apply acupuncture. Thank you for your attention.